The current most important focus for the SwissNeuroFoundation is on neurovascular diseases. These diseases impact mainly the neurological conditions of patients. Neurovascular diseases are the most frequently found diseases, and it means that the aging of the brain is also related mainly to the aging of the vascular structures. The entertainment of circulation for the brain is the utmost important preparation for normal brain function. Now, when it comes to neurovascular diseases and aging of these neurovascular structures, the most frequent disease is stroke. Stroke is something that has come in mind of everybody since we are capable of taking care of these events that all of a sudden may appear in a patient's life and require immediate attention. The structures developed in neuroradiology and interventional neuroradiology have allowed to address these conditions very quickly. We can image these diseases, we can help the neurologist make the diagnosis correctly, and we will support the neurologist when it comes to repair and unclog big vessels that have been occluded with a stroke. There are other diseases that are also quite frequent, and they entail aging of the vessel wall. This aging, unlike in the peripheral circulation, is more frequent when it comes to outpouching, so the wall gets weaker. You must imagine that brain vessels are almost naked around on the surface of the brain, and they are exposed to very dramatic flow conditions over time, over the life cycle of a person. These flow conditions may lead to local fatigue, and this fatigue to areas of weakness that will outpouch and can stabilize and scar well, but also can get bigger and bigger and all of a sudden in an unstable condition rupture and lead to a hemorrhage. Also, this condition is more and more frequently discovered incidentally in brain imaging, and interventional neuroradiology has understood to improve the technology to take care and repair and bring such diseases again in a stable condition where people don't need to worry anymore about rupture. Another condition that is yet underestimated is the aging over time of small vessels and the circulation as a whole of the brain. This can rapidly show up as a problem when we are exposed to specific stress. A vulnerable brain that has to undergo a surgery and anesthesia will suffer more if it's exposed to less perfusion pressure, maybe inflammation, and this will bring a patient to what we call a post-operative cognitive disorder, a delirium, or even an early dementia. It is, again, I think, our field that has to help improve this condition, understand, identify these patients, and when identify, help to precondition the situation and avoid the patient from getting in such difficult situation. Other rare diseases of neurovascular pathology involve what we call vascular anomalies. That's where the building of vessels are wrong and where we have direct connections developed between arteries and veins. And these conditions also will potentially lead to a higher circulation and early aging of the vessel wall and risk to establish a condition where we have a risk of bleeding. or a risk of disturbed local circulation leading to malfunction of the brain. All these conditions today are increasingly better understood, and one of the big missions of the clinical neuroscience is to bring all these parameters together and do this in the interest of patients. That's the mission of the SwissNeuroFoundation, with furthering clinical neurosciences and establishing care delivery value chain conditions for all these diseases in the interest of patients.